Hey, everybody. Thank you all for joining us to discuss the updates included in the upcoming NHSN release. My name is Molly Stillians, and I am a nurse infection preventionist here at the CDC. My primary area of focus in my role at the CDC is using NHSN surveillance to improve outcomes in long-term care facilities. As Courtney mentioned, my colleague Carla Cooper will also be joining us and presenting today, and you guys will hear from her a little bit later. So the learning objective for this training is to understand and apply updates to the NHSN criteria for surveillance data reporting in the long-term care facility COVID-19 module. The long-term care facility COVID-19 module currently consists of 4 surveillance pathways for data reporting. Collectively, these pathways optimize timely, standardized data collection used to strengthen COVID-19 surveillance locally and nationally, in addition to informing ongoing activities to support providers and direct resources. Once the updates go live, the COVID-19 surveillance pathways will only consist of 3 pathways. So we will have resident impact and facility capacity pathway, staff and personnel impact, and also the therapeutics pathway. Today, during this training, we will focus on resident impact and facility capacity, which you will hear me refer to as RIFC, and also the staff and personnel impact pathway. So I will now review the updates that will occur within the RIFC pathway. Listed on the slide are components of the RIFC pathway that will be removed with the upcoming May release. The following data elements will be removed: COVID-19 test type, vaccine manufacturer for primary series, vaccine manufacturer for additional or booster doses, COVID-19 reinfections, including symptomatic and asymptomatic, respiratory illness, and influenza and COVID. There will also be 2 testing questions removed from this pathway. The questions that will be removed are: since the last date of data entry into the module, has your long-term care facility performed SARS-CoV-2 viral testing on residents and or staff? And the other question that will be removed is, during the past 2 weeks, on average, how long did it take for your long-term care facility to receive SARS-CoV-2 viral test results from non-point of care tests? The reporting instructions for positive test count will be slightly revised. You will still need to report when a resident has a positive test. However, you will exclude counts in which a resident had a positive antigen test and a negative follow-up PCR. The follow-up PCR will need to occur within 2 calendar days of the initial antigen test to meet the exclusion criteria. For example, if a resident had a positive antigen test on Monday and a negative PCR test on Wednesday, then this would not be included in the positive test count. As discussed previously, the reporting procedure for positive tests has been slightly revised. Currently, users are asked to enter the count for any resident who has received a positive test during the reporting week. Then, based on the test types that are selected, the calculated total confirmed is populated by the system. With the updates, when the updates go live, the test type will be removed. However, the instances in which a resident has a positive antigen test and a negative PCR performed within 2 calendar days of each other will need to be excluded from the positive test count. So here's an example. We have our fictitious nursing home, DHQP nursing home. They have had 5 positive tests during this reporting week, 3 positive antigen tests, 1 positive PCR, and 1 positive antigen test and a negative PCR performed 1 day after the initial antigen test. How many positive tests will they report this week? They will report 4. So the positive antigen with the negative PCR is not included in the test count. So that is why only a count of 4 has been recorded. The vaccination status section for the primary series will be revised to only include 3 options. The primary series will no longer be categorized by manufacturer type. So what we'll have is not vaccinated, partial vaccination, and complete primary vaccination series. And again, the manufacturer type is no longer included, and we will go over these in more detail on a different slide as well. Also discussed on our previous slide, 2 of the questions regarding SARS-CoV-2 testing have been removed. 1 question regarding the testing will remain in this pathway and has been revised to collect information regarding testing availability and testing resources for residents and staff. So what you will see in the pathway is, does the long-term care facility have the ability to perform or obtain resources for performing SARS-CoV-2 viral testing on all residents, staff, and facility personnel if needed? The additional or booster dose data element will remain the same, and no revisions have been made for that reporting process. However, 2 subcategories have been added to capture data regarding booster doses. So users will be able to report the number of residents who have received 1 booster dose and also residents who have received 2 or more booster doses. These categories are subcategories to the count reported for additional or booster dose. The sum of these 2 categories will need to be less than or equal to the count recorded for additional or booster vaccination. The counts recorded for 1 booster and 2 or more boosters is based on the count that has been recorded for the additional or booster vaccination count. For example, the user has recorded 4 of the newly positive residents have received an additional or booster dose. They will then record the number of those residents who have received 1 booster and 2 or more boosters. Okay, so here is an example. This facility has reported a positive test count of 5, and for additional or booster vaccination, they have recorded 3. And in this case, they've recorded a count of 2 for 1 booster and a count of 1 for 2 or more boosters. And just a reminder here, the sum of 1 booster and 2 or more boosters must be less than or equal to the count entered for additional or booster dose. And the reason that it can be less than or equal to is because additional and booster vaccination can include additional doses. However, when you're reporting counts for 1 booster or 2 or more boosters, that is only going to include booster doses. So no additional doses are included in those 2 counts. So for this example, 1 booster plus 2 or more boosters could have equaled up to 0, 1, 2, or 3. Since the additional or booster vaccination count is 3, you just want the sum of those 2 counts to be less than or equal to 3. There will also be a new data element within the RIFC pathway to collect data regarding residents who are considered to have an up-to-date vaccination status. In order to stay current with the up-to-date vaccinations, we have this link here for reference. So review the CDC definition for up-to-date at the following webpage. And this link will also be on the documents that will be on the webpage, our webpage, long-term care webpage, once everything is updated and goes live. There will also be a link in the TOI and in the form to NHSN surveillance definitions of up-to-date. So that will be a good document to reference when reporting this data element. Data elements related to the supply of PPE within facilities has also been added to the RIFC pathway. So users will be asked to indicate if their facility will no longer have any PPE supply items in 7 days. If the facility answers yes, then they will indicate which PPE supply items they will no longer have in 7 days. If the facility answers no, then they will not have to report any further information for the PPE supply items. So let's look a little further into the process that will occur for reporting vaccination status once the updates go live. So vaccination status of residents newly positive for SARS-CoV-2 through viral testing methods is reported in the resident impact and facility capacity pathway. So this is not to be confused with the weekly COVID-19 vaccination summary data used to report cumulative vaccination coverage for residents who have received COVID-19 vaccination. For more information on that module, the link posted here will take you to their webpage. But just want to make that differentiation that this is for the RIFC pathway, what we're discussing. And what you'll do within the RIFC pathway is report the vaccination status for residents who you have reported as being positive for that week. When reporting vaccination status of residents newly positive for SARS-CoV-2, include only new counts, since the last date these counts were collected for reporting to NHSN. Do not report cumulative counts into the RIFC pathway. For residents newly positive for COVID-19, the COVID-19 vaccine dose received inside the 14-day window, specifically received 13 days or less before the specimen collection date for newly positive SARS-CoV-2 test result, is not counted when reporting vaccination status. The 14-day window will apply to the primary series as well as additional and booster dose vaccination. If the resident received COVID-19 vaccination 14 days or more before the specimen collection date, and specimen collection date is the day that you perform the test, the COVID-19 test in which that result was positive. So if it was 14 days or more before the specimen collection date, then the dose in question is counted for reporting purposes. However, if the resident received COVID-19 vaccine 13 days or less before the specimen collection date, then the dose in question is not counted for reporting purposes. So for example, if the first dose of a 2-dose COVID-19 vaccine series was received 35 days prior to specimen collection, but the second dose was received 10 days prior to the specimen collection date, the vaccine status for the resident newly positive for COVID-19 is to be reported as the resident received only 1 dose. So this would be considered partial vaccination. So this diagram shows the timeline for the 14-day window. So as you can see here, day 1 is considered the day of vaccination. And if the positive test occurs anywhere between day 1 and day 13, then the dose is not counted. If the positive test occurs on day 14 or after, then the dose is counted. So the vaccine options for the primary series will be updated as discussed on a previous slide, and we will have 3 options for primary series. Not vaccinated includes residents who have not been vaccinated with COVID-19 vaccine or residents whose first dose was administered 13 days or less before the specimen collection date. Partial vaccination includes residents who have received only 1 dose of a 2-dose mRNA vaccine, for example, Moderna, Pfizer, or 1 dose of an unspecified COVID-19 vaccine. And then complete primary vaccination series includes residents who have received dose 1 and dose 2 of a 2-dose mRNA vaccine, for example, Moderna or Pfizer, or dose 1 and 2 of an unspecified COVID-19 vaccine. This can also include 1 dose of Janssen. And the second dose will need to have been received 14 days or more before the specimen collection date, otherwise count it only as dose 1. So here's an example. Our fictitious nursing home, DHQP nursing home, reported 8 positive tests for the reporting week. 1 resident has not received any COVID-19 vaccine. 1 resident received the first dose of a 2-dose series vaccine 10 days before the specimen collection date. 2 residents received dose 2 of a 2-dose series vaccine 12 days before the specimen collection date. And 3 residents received dose 2 of a 2-dose series vaccine 45 days before the specimen collection date. And then 1 resident received dose 1 of a 1-dose series vaccine 62 days before the specimen collection date. So how will we record these counts? So we will have 2 for not vaccinated, 2 for partial vaccination, and 4 for complete primary vaccination. And we can see that again here on this screen. So the first bullet, this resident was not vaccinated, so that's the count they get included with. And then for the second bullet here, the first dose of a 2-dose series, so the first dose was only received 10 days before the specimen collection date. So that is considered not vaccinated. And then our third bullet point, 2 residents received dose 2 of a 2-dose series 12 days before the specimen collection date. So that dose 2 wouldn't count since it wasn't 14 days or more. So that's considered a partial vaccination. Second to last bullet here, 3 residents received dose 2 of a 2-dose series vaccine 45 days before the specimen collection date. So that does satisfy the 14-day window. They have received their complete primary series. And our last bullet, 1 resident received dose 1 of a 1-dose series 62 days before the specimen collection date. So this is also complete primary series vaccination. So currently, facilities can report if a resident with a newly positive SARS-CoV-2 viral test result also received an additional or booster vaccination. Users will need to report counts for the primary series vaccination before reporting any counts for additional or booster vaccination. The count entered for additional or booster vaccination must be less than or equal to the count entered for complete primary series vaccination. And the 14-day rule does apply here as well. So here we have another example. Our nursing home has reported a count of 4 for the primary series vaccine option of complete primary vaccination series. And of those that they have reported, one of them received an additional dose 5 days before specimen collection date. One resident received an additional dose 22 days before specimen collection date. One received a booster dose 90 days before specimen collection date, and one received a second booster 16 days before specimen collection date. So how will we report these counts? So additional or booster dose vaccination will have a count of 3. And this is because one resident received an additional dose only 5 days before the specimen collection date. So that is not included in the additional or booster vaccination count. As discussed previously, there will be 2 new subcategories of 1 booster and 2 or more boosters. So 1 booster includes residents who have received only 1 booster of COVID-19 vaccine, and that's any manufacturer. 2 or more boosters includes residents who have received 2 or more booster doses of COVID-19 vaccine since March 29th of 2022. For each of these fields, 14 days or more should have passed before the specimen collection date in order to report these, to include these counts. Also, the sum of these counts must be less than or equal to the count reported for additional or booster dose. So we have another example here. DHQP nursing home reported a count of 3 for additional or booster vaccination. One resident received an additional dose 22 days before specimen collection. One resident received a booster dose 90 days before the specimen collection. And one resident received a second booster dose 16 days before the specimen collection date. And that second booster was received on April 12th. So how will we report these counts? We'll put a count of 1 for 1 booster and a count of 1 for 2 or more boosters. Since one resident received an additional dose, that would not be included in either of the counts. Since it is an additional dose, it wouldn't go in the count for 1 booster or 2 or more boosters. So we have another example here. Our nursing home reported a count of 4 for additional or booster vaccination field. One resident received an additional dose 57 days before specimen collection date. One resident received a booster dose 60 days before specimen collection date. One resident received a second booster dose 20 days before specimen collection date, and this was received on April 26th. And then one resident received a second booster dose 30 days before specimen collection, and this was on May 10th. So this is how we would report counts for the example that was just shown. We would put a count of 1 for 1 booster and a count of 2 for 2 or more boosters. And this is because one resident received an additional dose, so they are not included in either of these fields. One resident received 1 booster dose, so they're included in the 1 booster dose count. And then 2 residents received 2 or more boosters after the date of March 29th. So they are included in the 2 or more boosters count. Up to date is also a new field that will be added with the new updates. And this field will include newly positive SARS-CoV-2 residents who are also up to date with COVID-19 vaccines. So here's an example. Our nursing home has reported a count of 4 for the primary series vaccine option of complete primary series vaccination. And of those, one resident received a booster dose 6 months after they received the primary series, and the booster was received 22 days before specimen collection. One resident received a booster dose 12 months after they received the primary series, and the booster was received 90 days before specimen collection. One resident received a second booster dose 8 months after they received the primary series, and this booster was received 16 days before the specimen collection date. So this is how we would record the counts for up to date for this example. We would put a count of 3 here. All of the residents in this example were eligible for a booster shot and received that booster 14 days or more before the specimen collection date. Oops. So the question regarding testing availability has been revised. So let's take a look at the new question. So what you will see is a question asking if the facility has the ability to perform and obtain resources for residents and staff. And you can answer yes if the facility has the ability to perform and obtain resources, or no if the facility does not have the ability to obtain or perform the testing. Questions regarding PPE shortages within facilities has also been added to the RIFC pathway. So as shown in the screen, this section will appear in the RIFC pathway once the updates go live. This section will ask facilities to indicate if they will no longer have any PPE supply items in 7 days. If the facility has a shortage of a PPE item and will not have any more of this item in 7 days, then this would be considered an urgent need and they would select yes. If they select yes, then the PPE supply item options will appear and you will select which one that you have an urgent need for. Could be one or more. So when you guys see this in the user interface, you'll see the question and you will select yes or no if you have an urgent need. If you select yes, as previously discussed, you will get the rest of the options to then select yes or no if you have an urgent need for that specific supply item. If you select no, then you will not have any further items to report on. So let's go through a step-by-step process of reporting into the vaccination status section of the RIFC pathway. So step 1 will be to access the NHSN homepage, and you will click on Pathway Data Reporting from the left-hand menu. Once you hover over COVID-19, you get a pop-out menu. Then you will select Pathway Data Reporting. This will take you to the calendar page where you then can select the date in which you would like to report counts. Step 3 will be to enter the census. You will need to enter the census in order to save your data within the RIFC pathway. And then enter admission counts. And then you will enter the count for positive tests. Remember, do not include residents who have had a positive antigen test and a negative PCR performed within 2 calendar days. Day of specimen collection is calendar day 1. So for this example, we've recorded 4, a count of 4 for positive tests. We will then record our counts for the primary series. And the sum of these 3 options will need to equal the count recorded for positive test. So in this example, the 3 options listed here will need to add up to 4, since our positive test count is 4. The next step will be to enter counts for additional or booster vaccination. Once you have entered counts for the primary series, then you will move on to enter counts for additional or booster vaccination. Of the residents newly positive for COVID-19 and who have received the complete primary vaccination series, indicate residents who have also received an additional or booster dose of COVID-19 vaccine. The additional or booster dose would need to be received by the resident 14 days or more before the specimen collection date. The count entered for additional or booster vaccination will need to be less than or equal to the count entered for complete primary series. And in our example here, we have entered a 2 for additional or booster vaccination, which is less than or equal to what we have entered for complete primary vaccination series. The next step will be to enter counts for booster doses. Once the counts for additional or booster vaccination have been entered, you can move on to enter counts for the 2 new subfields, 1 booster and 2 or more boosters. Of the residents who are newly positive for COVID-19 and have received an additional or booster vaccination, indicate how many of those residents have received 1 booster or 2 or more boosters. The sum of the counts entered for one booster and two or more boosters must be less than or equal to the count entered for additional or booster vaccination. And as you can see here, that is how our counts add up. We have a 1 for one booster and a 1 also for two or more boosters. The sum of those two categories is equal to what we have for additional or booster vaccination. And the sum just needs to be less than or equal to. So step 9 will be to enter the count for up to date. So once you've entered counts for one booster and two or more boosters, move on down to enter the count for up to date. Of the residents who are newly positive for COVID-19, indicate how many of those residents are up to date with COVID-19 vaccines. The count entered for up to date must be less than or equal to the count entered for a complete primary vaccination series. And as you can see here highlighted in yellow, we have entered a 2 for the complete primary vaccination series. And then we've also entered a 2 for up to date. So we could have entered anything from 0, 1, or 2 in order for that to be less than or equal to the complete primary vaccination series. So the last step is just to review your counts and move on to enter data in the rest of the pathway. So what we have entered here is 4 positive residents for this reporting week. And of those 4 residents, 1 is not vaccinated, 1 has had partial vaccination, and 2 have had the complete primary vaccination series. Of the 2 that have had their complete primary vaccination series, 2 of them have also received an additional or booster vaccination. Of the 2 residents who have received an additional or booster vaccination, 1 of them has received 1 booster, and 1 of them has received 2 or more boosters. And then also, of the 2 residents that we have included in the complete primary vaccination series, they are both up to date. So we have entered a count of 2 for up to date. So on the NHSN long-term care facility COVID-19 module webpage, there is a guidance document for the RIFC vaccination status section, and this will walk you through step-by-step, like how we just did in the slides. It'll walk you through step-by-step how to enter data into the vaccination status section for the RIFC pathway. And this will be updated on the website once everything goes live. So you'll be able to access this document from going to the webpage. I will now turn it over to my colleague Carla, and she will go through the rest of the updates with you guys.
Thank you, Molly. I will now provide the updates impacting the staff and personnel impact pathway. Data elements have been removed from the staff and personnel event form. Long-term care facilities are no longer required to report counts for staff and personnel impact COVID-19 test type or COVID-19 reinfections. Additionally, facilities are no longer required to report counts for staff and personnel impact for non-COVID-19 respiratory illness or staff and personnel impact co-infections. The staff and personnel impact pathway has been simplified to include a drop-down box for reporting staff and personnel shortages. If you select no, there's no additional information to provide. If you select yes, the staff and personnel shortages questions, you will be prompted to answer yes or no for specific staff and personnel groups. Next, I will now go over the updates in the supplies and personal protective equipment pathway. Facilities no longer have to report data for supplies and personal protective equipment. The pathway will be removed from the user interface. I will now cover a few tips and resources for the NHSN COVID-19 module. It is expected that users will consistently collect and report data into the NHSN long-term care facility COVID-19 module. Consistent and timely reporting is important for assessing local, state, and national trends, as well as in response efforts. It is important that users review the data collection instructions. also referred to as the table of instructions that are available for every surveillance data pathway. Specifically for COVID-19 surveillance pathways, data collection instructions specify that data is to be reported to NHSN once per reporting week. It is important that reported counts each week represent only new counts. In other words, report only the new counts that have occurred since the last day these counts were collected for reporting to NHSN. Do not include cumulative counts for previously reported weeks. Users must also be aware of any local and/or state requirements for reporting data into the NHSN COVID-19 module. Users are strongly encouraged to take advantage of the resources available on the NHSN LTCF COVID-19 module webpage. This webpage is the best resource for NHSN users reporting data to the COVID-19 module. The webpage provides users with access to enrollment information and resources, trainings, including upcoming and archived trainings, and the most updated data collection forms, form instructions, and resources. I highly recommend reviewing the table of instructions for each pathway and using that document as you are reporting. This will help guide you with the reporting process and help you to understand how to report in each pathway. Users interested in learning more information about CSV file templates and upload are encouraged to visit the resource section of the NHSN LTCF COVID-19 module webpage. To access these resources, click Facility Resources or Group Resources, depending on your need. This is where facility and group users will gain access to the most updated resources for importing and exporting data. An example of these resources includes the most recent CSV data file templates for each pathway, as well as file layout documents with importing instructions. The file layout document is helpful because it provides tables to specify the variable names, values, format, and variable description for all the data elements in the CSV templates. These resources are available for both individual facilities and groups. This slide shows the RIFC Pathway CSV template and the file layout document for RIFC data uploads. The information is already entered into the CSV template as an example data. Please remember to delete this data before entering your facility's data to ensure you are recording correct data for your facility. The file layout demonstrates the variables that you will use when entering data into the CSV template. This document also offers explanation of each variable and whether or not they are required data elements. Each pathway has each of these documents. These can be found on the website as shown previously. A few takeaways and reminders for the COVID-19 module. When reporting counts, only include new counts since the last time counts were collected for reporting to NHSN. Do not include the same resident in the same count every day. Only count each resident one time for the same question. This means you are not to report cumulative counts for the COVID-19 module pathways. Facilities need to report data to the COVID-19 module at least once a week. If you have any further questions and/or concerns, please send an email to nhsn@cdc.gov. Please add a brief description in the subject header, such as resident impact and facility capacity pathway, vaccination status section. This description will enable user support to quickly triage your email to the correct subject matter expert. This concludes the LTCF COVID-19 module updates webinar. Thank you all for joining today.